On May 15th, 1954, a young mother in Romania gave birth to a son. Little did she know what would become of his life. He had a heart condition at age 7. He developed arthritis, could not walk for a year. He spent months in the hospital, missing school. At age 15, he weighed 69 pounds, which is about half the average weight of a 15-year-old. In his words, he said, "My body was the body of a 4-year-old." But that mother didn't give up. The doctor said, "We can't do any more for him." And she said, "Please, please, please." Well, the doctor had a neighbor who was a weight trainer for the Romanian youth. Srozin went to that local gym. The trainers tried to turn him away, saying he was too small. He persisted, though, and when he showed them a letter from the doctor, they allowed him to train there. I met Dragomir Srozin over 20 years ago, and he became the weightlifting coach for the Olympic weightlifting team. At the time, I was working for Mead Johnson, and we had a nutritional supplement, which we were selling to the Olympic team. Dragomir's story from going from this weak child that couldn't even walk to becoming a weightlifting champion gave me new respect for muscle. That's why I titled this Muscle Up. Up until then, I thought weight training was a vanity exercise. But there may be a reason why people admire muscles. There may be more than vanity. Oh, is that the first one? Okay. Yes. Okay, sorry. Look at these young men. These are our sons many years ago. There's Michael, Gare, John, and Leif, who you met Gare. I thought about this. What is it? It's not just that muscles move your bones. There's more to it. There's another example. You can, not yet. We don't go to the next one. But Dr. Doug McGuff, who is an ER physician and fitness trainer. As a teenager in the 1970s, he started BMX racing in Texas, but wasn't very good at it. But he started weightlifting with his brother's weights in the garage. He has explained how weight training impacts the whole body. Skeletal muscle does just much more than produce movement. It is, according to him, and he has become a physician. He's an ER physician as well as owns a gym where he trains. He said skeletal muscle is the largest and most active endocrine organ in the body. Let me repeat that. The most active endocrine organ in the body. As a nurse, I learned about the endocrine glands. The hypothalamus, the pituitary, the thyroid, the liver, pancreas, adrenal glands, gonads. Nobody ever talked to me about muscles being an endocrine tissue. But they release hormones, chemical messengers called myokines. There may be something even more, but chemical messengers that send messages just next to the muscle and throughout the body. And they have a hormone-like effect on every tissue: skin, hair, bone, nerves, heart. To the skeptics, there are many clinical studies. There are myokines that suppress tumor growth. There are myokines that improve insulin sensitivity. There are myokines that reverse aging in muscles. The Annals of Medicine published a review. Some of the findings: breast cancer patients with more muscle mass had higher survival. ICU patients with more muscle mass had less time on the ventilator. And COPD, chronic obstructive pulmonary disease patients with more muscle had fewer respiratory problems, less osteopenia, less osteoporosis, so stronger bones. Alzheimer's patients with more muscle mass had less symptoms. In fact, the principal author of that study, Carla Prado, suggests that muscle mass should be a vital sign along with blood pressure and pulse. It's great, though, that we don't have to wait for more studies. We can do this ourselves. And if you think, I just want you to think about the personal stories of Dragomir Shrosman, who became the weightlifting, he won the bronze medal in 1980. And then Doug McGuff, who was the physician, the BMX biker. You too can write your own story. By increasing muscle mass, you can probably join the champions. Thank you.